Hi there, it's Dr. Buford. We're just getting started on the left shoulder. We confirmed that your shoulder would dislocate actually quite easily, not only to the anterior direction, but also to the posterior direction. And this is our first look inside the shoulder. The camera's coming in from the back and you're laying on your side, so the top of your shoulder is actually to the right on the screen. The bottom of your shoulder is to the left. If you were standing up and I was standing behind you, it would look like this. Okay, with the arm coming off, that's the humeral head coming off to the left. So your arm is up in the air, you're laying on your side, and this is what we do to get our cannulas in position. This switching stick is already coming in the rotator interval just behind the biceps tendon, and this other cannula here is a really important position where the second cannula is going to go. You can see it's just above the subscapularis. This is the leading edge of the subscapularis, the superior edge. This is a very wispy middle glenohumeral ligament. You can see how wispy that is. I can almost get all the way underneath it. See that? So there's really not much middle glenohumeral ligament. There's certainly nothing that we could inject. And then this is the anterior inferior glenoid. And we can see all the way around to the back here. So we're going to put our second cannula right there. As I pull back a little bit, we'll give you an overall picture how this glenoid looks like an island. See how much room there is? There's just a lot of capsular laxity, and that's going to all change at the end of the surgery. But there's really not a well-defined posterior band of the inferior glenohumeral ligament, which normally runs right in this region. The rotator cuff looks great. That's at the top of the screen here. And then as we look down the front of the shoulder, we can see that right now the humeral head's basically subluxated inferiorly. See how the ball's not sitting over the head? This would be reduced. And when we do that, we can see how there's really poorly defined anterior inferior glenohumeral ligaments as well. And when we let go of the arm, it very easily subluxates not only anterior but also inferior. So we'll go off on the video and get these cannulas in position. Okay, so now we're looking from the front. This blue cannula is coming in the back of your shoulder. As we look down the front, you can see, just lift up on the arm a little bit, guys, straight up. As we lift up on the arm, you can see the anterior. There's a little bit of a band of the anterior inferior glenohumeral ligament, but not much. This is a rasp, and we're going to use this just to roughen up the capsule a little bit. We're not trying to really take away any tissue. We're just trying to create a healing response and basically make this like Velcro so it gets sticky and sticks together. The next step is going to be to use a spinal needle to plan our angle for our posterior suture anchor, which is the one I like to place first here. You can see with the rasp, we can go all the way through the inferior recess like that. Okay, so now we've roughened that up a little bit. We'll pull out the rasp, we'll take our spinal needle, and the anchor system that we're using allows us to pass these anchors in a percutaneous fashion. So, you know, we can place an anchor down something like that, and I like that position, so we'll get to work on doing that in just a minute. Okay, so we're going to get our drill guide down right about here. And now we'll place our anchor right down in that same hole. And there you can see the two sutures. We'll pull back on because that seats the anchor, and that's very good. So now we're going to pass these sutures around. We're going to take one out the front. So crochet hook to me and a pincher tool to guard. Actually, I can do it just here. So we'll get one of these just like that. Grasper in the front. Turn to the right to me. Go other way. And so you'll see our suture hook come in the back here. There it is. It's loaded with a black wire called a super shuttle. It's got a hole in several places so that we can pass the sutures. And the trick here is we're going to start here like that. We're going to rotate back. We're going to do a little bit of a shift by moving inferiorly this way. And then we're going to go through. We'll get this stitch done and show you some more in just a minute. Okay, here's that first stitch. This is what we call the pinch. See, this allows me to pull on the capsule. See how I do that? And then we're going to go through right there. That looks like a good bite. So we'll go ahead and feed the relay. We're going to retrieve that and shuttle the suture. Okay, as we pull back, you can see how the black wire is actually pulling that blue and white striped suture, and as we pull tight, you'll see that go all the way underneath. And now I'm going to do a special type of mattress stitch. It's called a figure 8 because I think it's a little bit stronger. So we're going to reach in from the front and use this same suture one more time. We're going to repeat the exact same process. Grasper in the front. So now we're going to start here. We're going to make sure we have good space. Now you can see we're creating that pinch like that. And now we're going to go underneath the capsule right here a second time. Again, there it is coming out right there. Hold this right here. We'll go ahead and grab the relay here. We'll show you some more in just a minute. Okay, so we've tied that figure 8 mattress stitch in the back, and you can see how that nicely tightens the posterior capsule and really already has done a lot to close down the capsular volume. I'm now going to take my guide and find a spot. Lift up on the arm just a little bit straight up, or pull back towards you just a little bit. It's just easy, yeah. So 6 o'clock is right there. We're going to place this down. Maybe a shade lower. You have a real petite shoulder, obviously, so we're going to get one right there, I think. Hold the camera there with the right hand. We'll show you some more in a little bit. Okay, so there's suture number 2. It's very solid. Just like before, we're going to reach in and shuttle the suture. So there's one right there going out the back now. Now we're going to put a grasper in the back and take a turn to the left suture hook in the front. We're going to tighten up this ligament there. You can relax. So put that there and then turn to the left to me. So I'll show you what the turn to the left looks like. Looks like that. Pull that back, please. Okay, so we've got the first stitch passed. Lift up again on the shoulders a little bit. You can see it's actually coming right through the anterior band of the inferior glenohumeral ligament, so that's good. We're going to do a mattress stitch, but not a figure 8 in the front. So that means we just take the second stitch here. So now you'll see a different type of mattress stitch. And we're going to pass that a little bit above. Again, we're just trying to close down all this volume. See all this volume here? That's why the shoulder's dislocating. We're going to take a grasper in the back, turn to the left in the front, grasper to guard. So we'll put in that same suture hook. And this time we're going to try and make our stitch right about here. Okay, so we've tied that anterior mattress stitch. You can see how there's still a lot of space here, but we've really closed down inferiorly. The other thing you can see is that the ball is getting more and more centered over the head and not slipping out the bottom. So we're going to take that T-handled guide. We're going to place one more suture anchor here. I'll show you where that's going to be located. That's going to come down, and we're going to place this. This is probably going to be the final suture anchor, actually, the way things are looking. And I think we're going to place it right about here. So we'll get this done and show you some more in just a minute. Hold the camera. Okay, there's the next one. We're going to take our crochet hook. We're going to take one of the sutures out posteriorly like we showed you before. Okay. And now we're going to put a grasper in the back, turn to the left in the front. Left. Yeah. And we're going to rehearse the stitch by starting here. Pull that back. No, yeah. And we're going to rotate. We're going to go in right about here. There you can see it's coming through. Show you some more in a little bit. Okay, here's the final mattress stitch. After this, we're done. Watch that, switch hands. And but I just wanted to show you here. We're going to put our post right here because the tissue is a little more robust. We can go over what all that means in the office. Sorry, Garth, I know I keep bumping into you. And so these are what we call non-sliding knots. It gets hard to see when they work well. See how it gets hard to see there? But that's basically where it is. And then we've got some little knot tying tricks. This is basically like tying your tennis shoes through a straw. And so we just practice that, and then we can do it pretty easily here. There's that knot. We put about 5 half hitches on the knot just to make sure it's secure. Sorry, I'm losing a little bit of focus. Let me see if I can help with that. There we go. So, not a lot of surgery. It's been about 40 minutes. But you certainly needed it, and it has made a big difference structurally in your shoulder in terms of tightening things up. So I'm glad we finally got you here so we can get you on the road to recovery. So that's the end of that mattress stitch right there. I'm going to cut the suture tails. This is an instrument that's named after a shark. It's called a katana. And now that's cut. And so here we are. So you can fast forward, not fast forward, you can rewind the tape and see where we started with your shoulder. Now we have that posterior mattress. We have 2 anterior mattresses. Remember all that space that was here? Now there's just a little bit of a recess there that's actually part of normal anatomy most of the time. And down the front of the shoulder, it gets hard to even see. So I'm really happy with the way that looks. We're going to finish up here and get you back to the recovery room shortly. So good luck to you now. Bye-bye.